Hello everyone, once again welcome to my IT channel. Today I came with something different case note. So everybody knows that we used to write OIT letter to a specialized person. It can be a doctor, can be a nurse, can be occupational therapist or physiotherapist, pharmacist, different type of persons. But everywhere we will have only one patient, right? But in some case not, we will have one associated person. Like we are writing regarding a person, example like a veteran, and we will request the assistive services for his wife also. Sometimes we will write the letter to a patient regarding a baby. Maybe we will ask the assistive services for mother also. So this is quite natural we used to see in our OET case letter. But today I will show you another one peculiar case note. Here we will have two babies, that is twins babies, and we are going to refer these babies to a single staff, that is the newborn care specialist nurse. So I hope this is something different for you. First time you are hearing, I hope. So how we will write in a letter? Two babies, two patients, and two diagnoses, two case notes, and two different management. How it can be possible? Anyway, let us see how it will work. So first of all, for you, I will read you the case note. Here we have two twin babies. This is Ryan and Rohan. They are the patients in a newborn ICU, where you are the NICU charge nurse at Royal Women's Hospital, Sydney. Mother is already discharged and babies are yet to be discharged. Age 1 week old babies, and address is given 1278 Overwood Avenue, Victoria, Sydney 00099. Mother's name is Mrs. Angelina Michael. Date of birth is 19/10/1995. And she had gestational diabetes mellitus during antenatal period, and she attended all antenatal visits. Father is Michael Luke, 34 years, and he is a graphic designer. And other children, they have another one girl, 2 years old girl, Rayona Michael. And we will see the medical history. This mother has admission on 8/1/2019, complained of fetal distress due to cord entanglement. So they took the patient for cesarean section at the midnight on the day of admission. So the delivery date is 8/1/2019. And we can see the baby's case note. The first baby is Ryan. Today he is 3 days old baby. And first baby aspirated meconium, and he has decreased heart rate, increased respiratory rate, fluid discoloration on upper and lower extremities. So the UPCOR score was 4 out of 10. Poor sucking, and they have given oxygen therapy 2 liters per hour. And his weight was 2.5 kg. They are fraternal psychotic twins. And medical progress today, that is 17 January 2019, the diagnosis for Ryan is poor sucking. Nursing management, they have given prophylactic antibiotic therapy with ampicillin 50 mg BID and gentamicin 15 mg BID, and he has been in radiant warmer therapy. IV fluid DNS has been given, and oxygen therapy through the tent, CPAP for 3 days after delivery. So this is the case note for the first baby, Ryan. And we will see the second baby. His name is Rohan. And second baby's weight is 2 kg at the time of birth. Poor sucking. UPGAR score, heart rate was good, but decreased respiratory rate. Both are expelled meconium. So for both of them, meconium aspiration happened. And for him, the peculiar diagnosis is cleft palate and cleft lip. So the mother is depressed. And the nursing management for Rohan is IVF, DNS therapy, oxygen therapy through the tent, and radiant warmer therapy to continue. It should be continued till he gains weight. And they have given the general discharge date. It's something confusing, but you have to segregate the nursing management. The future management. Rohan needs radiant warmer therapy. That is the second baby needs to continue warmer therapy. Monitor sucking ability of both children. So this is common for both children. Continue intravenous fluid therapy for both children. And Rohan needs pediatric surgical intervention for cleft palate and cleft lip. Monitor their weight every day. This is common for both babies. need psychological support for their family, especially for their mother. So here, for Rohan specifically, we need to continue radiant warmer therapy, and he needs surgical intervention. And the remaining three interventions are common for both babies, like monitor the sucking ability and daily weight checking, and continue the intravenous fluid therapy. So these are all are common for both babies. So these are all the plan for both babies. Next one, we will see the writing task. Using the case note, write a referral letter to Miss Daniela Robertson, newborn specialist nurse, Sydney Children's Hospital, Australia. Inform her of the current situation, medical background of the newborn babies, and request an immediate management for both babies. So this is the writing task for our case note. So we are going to write one case note with two babies data and different nursing interventions. So we will see how the letter will be. We will start our letter with the date. Today's date is 17 January 2019, and the address is Miss Daniela Robertson, newborn specialist nurse, Sydney Children's Hospital, NSW, Australia. Salutation is Dear Miss Robertson, regarding Ryan and Rohan. Date of birth is same 8 January 2019. To the introduction. So in this introduction, you have to introduce both babies and you have to inform them they are the fraternal twins, and you have to separately indicate which baby has which condition and what is the requirement for both babies. So we will write like this. I am writing to refer Ryan and Rohan, comma, the fraternal twins of Mrs. Angelina Michael, who have poor sucking as well as cleft lip and cleft palate respectively. They require an immediate management at your facility. So here we wrote both babies' name, and we are indicating they are fraternal twins of Mrs. Angelina Michael. And we have to write both disease conditions like respectively. With the use of the phrase respectively, you can make combination. I mean, you can make a correlation between, like Ryan has poor sucking and Rohan has cleft lip and cleft palate. So that is the benefit of the usage of the phrase respectively. And both babies need immediate management at this facility. So like this way we can conclude the introduction. To the present medical paragraph. Here we have to make two paragraphs. One paragraph it is for Ryan and another one is for Rohan, so that the reader will not get confusion. We can just introduce like this way. Ryan and Rohan have delivered on 8 January 2019 by cesarean section due to fetal distress and cord entanglement. Next, we are going to write about Ryan. Upon observation, Ryan was found to have meconium aspiration and his APGAR score was 4 out of 10, along with poor sucking and birth weight of 2.5 kg. Thus, then we are going to write regarding the management. What are the management we did at our hospital? Thus, he was managed with prophylactic antibiotic therapy, ampicillin 50 mg twice daily. We have to keep comma in between, and gentamicin 15 mg twice daily, along with intravenous fluid therapy DNS. Then we can make an connective also, comma, he was commenced on oxygen therapy by 10, don't use via, you can write by 10, radiant warmer therapy as well as CPAP for 3 days. Here you can see this radiant warmer and oxygen therapy, everything it is finished for this baby. So we can write commenced on, was commenced on. But for the next baby, we have to write has been, because still he is on radiant warmer. So this is the first baby's information. So Ryan was found to have meconium aspiration and his of course scar was not good, and his weight is okay, but he has poor sucking. Then how we managed with the antibiotic therapy and intravenous fluid therapy along with oxygen therapy and radiant warmer. And this baby was in CPAP for 3 days. So which until here it is clear for the baby Ryan. Next we are going to write about Rohan. Upon delivery, Rohan was found to have meconium aspiration, poor sucking as well as low respiration rate. His APGAR score was good, but birth weight was 2 kg. Actually, for the first baby, Abga score was, it was very low, but this baby, Abga score was good, but there is, we can use birth or even though or something like that. Birth weight was 2 kg. Also, he has congenital facial deformity because in intro we already wrote regarding cleft lip and cleft palate. So here there should not be a repetition. So just we wrote congenital facial deformity. Then we will move to the management. Subsequently, he was managed with oxygen therapy by tent and intravenous fluid therapy. In addition, he has been treated. So we have to write has been treated because radiant warmer is still ongoing, and in future also in the recommendation paragraph we need to write the same. So instead that we can write here has been. So no need to repeat it again in the recommendation paragraph. In addition, he has been treated with the radiant warmer therapy which needs to be continued until he gains weight. So that's all regarding the baby Rohan. So we wrote already regarding the meconium aspiration, for sucking, and regarding the respiration rate. His upward score was good, but the problem related to the birth weight still it's continuing. And already we informed that patient has deformity, facial deformity like cleft palate and cleft lip. And what is the management? What all the management we have given? Oxygen therapy, intravenous fluid therapy, and radiant warmer therapy. It is continuing still. That's all regarding the baby Rohan. Next, we will move to the social history. Ryan and Rohan are second babies for their parents. They have one elder sister. Their mother had gestational diabetes mellitus during antenatal period. Other than that, we don't have any other information regarding father. Actually, no need to write, but for mother, we need to write that she had gestational diabetes mellitus during antenatal period. That's all regarding the social paragraph. Last one is the important paragraph regarding the recommendation. Here we should not make any confusion because this is the important points by this in like recommendation paragraph. By this recommendation paragraph only the reader will come to know what all the intervention she need to give. So it should be clear because we are going to write for both babies, two babies. So we can just segregate like the more important it is for Rohan because Rohan needs some more recommendations. The remaining everything it is common for both babies. So we can write like this: kindly monitor sucking ability of Ryan and Rohan as well as continue intravenous fluid therapy along with the daily weight assessment. So these three interventions are common for three babies. That means intravenous fluid therapy, weight check, and monitoring of sucking ability. That one we can write it in a single sentence. Then we can write about Rohan. Please arrange surgical consultation for Rohan to correct congenital abnormalities. And it would be appreciated if you could provide psychological support for their family, especially to the mother. So why we wrote it would be appreciated here, not in the starting means because this is additional help or additional assistance we are requesting to the staff nurse to provide to their mother. That's why here we just wrote it would be appreciated if you could provide psychological support for their family, especially to the mother. So it is clear here that what all the management they have to give to Ryan and Rohan. That means Rohan needs additional surgical consultation and radiant warmer already we wrote it in the present medical paragraph, so it's clear there. And for both babies, sucking ability how to be monitored and intravenous fluid therapy how to be continued and daily weight checkup how to be monitored. These are all the things how to be done for the newborn specialist nurse. So I hope it's clear here. Conclusion will be if you have any queries, please don't hesitate to contact me. Yours sincerely, registered nurse. So approximately in this letter we can see 195, maybe it will be 210 maximum, it will come counts like 210. We have just included all relevant data regarding both babies, and in the recommendation paragraph we just concised and we wrote. So that is all the thing what we did here. So the problem will encounter here when we are writing in the present medical paragraph, this one should not be combined. It should be in a two separate paragraph because the reader will get confusion. And the same problem will happen in the recommendation paragraph. You should not write like a separate. The reader will get confusion there also. So we can concise and we can write it in a simple sentence for both babies, and which need to be extra for separate another one baby, we can write like a separate, like a Rohan needs, something like that. And remaining everything we can write like a common. And even in introduction you may have confusion how to introduce the babies, so this is a easy way how we can introduce the baby with the mother's name. So it will be easy. And respectively, that phrase also, please try to use it in your letter, especially this respectively we can use it in social paragraph when you are writing regarding the past medical histories, and or if there is any with the medication with disease conditions and medications, if you want to correlate you can use this respectively. And even here it is very easy to write, or else we have to write that Ryan has this one, Rohan has this one. No need to write like that. It is like we can make it like a presentation, like a good presentation, by using by the use of some like special phrases. So I hope this letter it is clear for you. This is very rare letter, and it is we could not expect that this type of letters will come, but you can be familiar with every types of white letter, so that in case if you get some letters in this way or in another way, like two patients are there and you have to write two patients like in equal importance, means you will have an exposure. So I hope it is clear for you and it is helpful for you. And if you like, just keep it in your minds, the sentences, the construction, and the way how we will write everything. I hope you will make beneficial from this IT letter writing. Thanks for watching. We will see then another one informative video. Until then, bye, take care.